I'm Dr. Aaron Haug. I'm a neurologist and movement disorder specialist in Denver, Colorado, and wanted to talk about the important issue of constipation in Parkinson's. So constipation, extremely common among people with Parkinson's, up to 98%, according to some studies. And constipation can be either hard bowel movements or infrequent bowel movements. The goal really is to have a bowel movement daily, and we'll talk about some benefits of doing that. And so as we go through this short talk, I'll talk about a number of possible treatments. You should discuss these options with your provider to see if they're right for you. So why treat constipation? It's uncomfortable, of course, to be constipated. So that's a reason in and of itself. If you're constipated for very long, you can have this issue develop called impaction, where you develop a hard blockage of stool in the colon that makes it virtually impossible to have a bowel movement. By the same token, if that does occur, then taking laxatives intermittently can cause this yo-yo effect between constipation and diarrhea. It's also important to notice that if you are not constipated, your Parkinson's medications have a better chance of working well. Parkinson's medicines, especially Sinemet, is involved in this first part of the small intestine. And so if you're constipated, then there's less predictability of the medication being absorbed when you want it to be as it passes through the first part of the small intestine. Another thing to note is that if your gut is full, if you're constipated and haven't had a bowel movement, that puts pressure on your bladder as well, which can exacerbate an issue of overactive bladder and urinary frequency. So not being constipated can help to lessen that issue. So what can we do about it? There are a handful of lifestyle factors that are crucial to consider first. The first of these is exercise. The more you move your body, the more you'll be able to move your bowels. The second is hydration. If you're dehydrated, the colon's main job is to draw water back into the colon. And so if it's doing that more and more, the bowel movements are getting harder and harder. And so staying hydrated is important to prevent and treat constipation. Shoot for 64 ounces of water per day. A couple other nuances on fluid intake. Warm drinks in the morning can help with constipation. They can help get the gut moving. And by that same token, caffeine has a so-called prokinetic effect where it helps the gut move. What else can we do before we start talking about medications? Diet is a very important factor to consider, particularly how much fiber is in your diet. Shoot for 30 grams or more of fiber throughout the course of a day. Breakfast cereals are a good way to get fiber, and there are a number of high fiber cereals that do taste better than the box that they come in, so look for those. Prunes and prune juice are famous for a reason. High fiber content, helpful for constipation. Other fruits and vegetables also helpful. A note of caution, if you haven't been taking very much fiber into your diet, do increase this gradually. If you have an acute increase in the amount of dietary fiber that you're taking in, it can cause some cramping and bloating. So plan to increase gradually. So what about medications? The two main categories are stool softeners and laxatives. Many people with Parkinson's could really benefit potentially from taking a stool softener and a laxative together every day. And we'll talk about some of the options. So this is maybe a little crass, but memorable. Stool softeners and laxatives, the mush and the push. So when we talk about stool softeners, the mush, really the main one that's out there is docosate, or its brand name is Colase, and it's often a little red pill like this. And then when we talk about laxatives, it's really osmotic laxatives that draw more water into the colon that are potentially good to take on an everyday basis. So these are polyethylene glycol, which is Miralax, or milk of magnesia pictured here. And again, consider both a stool softener and an osmotic laxative together every day, potentially even multiple times per day. Some of the other options for the treatment of constipation include so-called stimulant laxatives. So these aren't ideal for everyday use because repeated use of a stimulant laxative can make the colon lazier. But if you go 2 or 3 days without a bowel movement, a stimulant laxative can be used in addition to the baseline regimen of Colase, and milk of magnesia, or Miralax, for example. Some of the options in the stimulant laxative category include Dulcolax and Senna, which is available either as a pill or also in a tea form. Bisacodyl also comes as a suppository, and Fleet's enemas are another more aggressive treatment option that can be used kind of lower in the algorithm after you've tried all these other things. There are a couple of prescription medications. All of the things that I mentioned up to this point are available over the counter, but a couple of prescription medications, Linzess and Amitiza, are currently brand name only and can be additional tools if needed. And just to mention that if you're on narcotic pain medications for any reason, those can cause their own type of constipation. And there's a medication called Movantik that can particularly help with opiate-induced constipation. A couple of final notes. Probiotics can be helpful. There's some research that shows that these can help to reduce or prevent bloating. So probiotics are probably not a bad idea. Sugar-free gum, which can also help some other Parkinson's symptoms like drooling because you have something in your mouth. The sorbitol in sugar-free gum has a prokinetic and osmotic effect and can help with constipation. And then a practical thing to consider is the positioning of your feet. And so there's this thing called a squatty potty that can help you position your feet appropriately to make a bowel movement easier to have. If you've tried all of these things with your primary care doctor, your neurologist, your movement disorder specialist, and are still having trouble, then consider consultation with a gastroenterologist. So exercise, hydrate, and increase fiber, and then think about the mush and the push. Thank you.